Okay, everyone, hello, and thank you for joining us today. It is 2:02, so in the interest of time, let's go ahead and get started. Welcome to our webinar, 7 Rules for Open Enrollment. TouchCare is gearing up to support 70% of our client population who have January 1 effective dates this time of year. And so today we're excited to discuss our favorite topic with you. And joining us to discuss our favorite topic is Jolie Daly. She is the Vice President of Customer Success at Picwell. Jolie is here to tell you more about our decision support partnership designed to enhance our client and member OE experience. And my name is Codi Gill. I'm the Vice President of Client Success at TouchCare. And let's go ahead and get started. All right, so in most locations in 2021, gone are the days of sitting in a training or a conference room, snacking on bagels while viewing a PowerPoint and listening to HR or brokers discuss plans and benefits that will be offered during their company's upcoming plan year. Prior to 2020, I remember attending dozens of meetings every year across the country. And regardless of the location, there were always those in attendance whose eyes glazed over and who clearly were all still very confused near the end of the presentation. So as we discuss open enrollment strategy throughout this webinar, we need to remember that 95% of the population cannot properly define basic benefits terminology. We also need to keep in mind that everyone learns and absorbs information differently. This should never be taken for granted and is a significant reason that we all, in general, have a confused population of healthcare consumers, while those people are expected to navigate the most complex healthcare system in the world. One of the major keys for a successful plan year is a well-informed, educated, and prepared population. If COVID has taught us nothing else, we have learned that people will adapt to what isn't the norm. We can make changes to what has always been done and supply amazing resources and information differently than ever before. In many cases, new enhancements that might differ from what has been done in years past are incredibly impactful. Also important to note, the audience in today's environment is more captive than ever. Individuals are paying more attention to their benefits due to the state of the world. At large, employees are invested and want to make the best decisions. Determining the best path to education involves recognizing what is old versus what is new, and what has worked in the past and what may not have worked so well. So out with some of the old and in with the new. We've discussed the old way of managing OE. In many cases, face-to-face enrollment meetings are not even possible these days. But what is possible? How can organizations adapt? And what resources can be provided? Can you create an OE strategy that aligns with every employee's needs and learning style? You absolutely can. So let's discuss how. The first step in developing a solid strategy is to evaluate your population. How do they typically communicate? What resources does your company leverage internally to communicate information? Understanding that at times, employees might not be the primary decision maker or the individual who manages benefits within the organization. How can you reach decision-making dependence? So oftentimes, if you're like my family, I'm the primary decision maker for our family and our benefits. My husband still has questions. So we're a little bit different because obviously I have a lot of experience, but in most cases, individuals need to take into consideration that there are others within the family who do help make those decisions. I can't express enough the importance of a thorough and correct OE benefits guide. One area of the benefits guides I have viewed that employees always seem to appreciate after the benefits information section is a robust FAQ. In the FAQ, questions can be answered to put an employee's or benefits mind at ease, such as, how do I obtain my member ID card for my benefits? Employers might call out each of the cards associated with the benefits and how each can be obtained or how they will be received automatically. Another question might be, what if I haven't spent the money that I've elected for my medical FSA last year? This provides an opportunity to explain the company's rollover plan for the year. Taking the time to think about the questions your employees might ask and offering a robust FAQ as a resource is a way to reduce noise during OE and to help employees feel confident moving into the new plan year. Benefits guides should be laid out in an easy to understand and simple to read format. Oftentimes, employees are email forwarding their employer's guides or bringing physical copies home to share with their significant other before they make a decision. Your benefits guide represents your brand. Even though benefits might not be all that exciting, even though some of us might think so, guides can be engaging and resourceful if constructed well. That said, a guide should be one resource for your employees. Let's discuss some additional creative resources that add value to your population and help employees actually make their plan decisions easily. Please allow me to reintroduce the Senior Vice President of Customer Success at Picwell, Jolie Daly.
Hi.
Oh, sorry, Jolie. I don't mean to trip over you. I was just going to announce that we've had the pleasure of working with you for a couple of years now. And we are really excited to have you introduce this solution as a component to our partnership and what we're able to accomplish for our clients.
Great. Thank you so much for having me. I really appreciate the opportunity to talk a little bit more about Picwell. And so, you know, kind of speaking to choosing benefits is hard. We know that choosing benefits is hard is because, you know, insurance is really complicated. And insurance is also something that we use to manage our risk. And so generally people have a really hard time thinking about risk, and Picwell can help with that. So risk depends on the health plan that you're in, and it's also personal. So everyone has their own unique situation and has their own risk profile. And so with the Picwell solution, you know, we're able to use data to see how different plans will protect you from the risk of high healthcare costs. We're able to see the risk that people like you face in each plan, and we balance that with the price that you pay for the plan, and present you with plans that, you know, which plans will give you the best bang for the buck with a simple score. So Picwell can be accessed anywhere from any device. We, you know, set up a unique URL for each of our clients that can be easily distributed to employees to use the tool and access the tool at any time. So on to the, Picwell, aside from helping with the medical plan decisions, Picwell can also help with other things. So some of the other things that we can help with is to help employees understand how HSAs work, and not only how HSAs work, but also helping them understand how much they should contribute based on their own personal risk or unique situation. So taking data of people like you, looking at the plans that, you know, that employees being offered, and taking into account lots of information such as, you know, the cost of the plan, what the plan covers, co-pays, co-insurance, as well as their personal risk to make those recommendations. And so we can help them not only choose that medical plan, but also understand things like HSAs or how much to contribute, or if you should consider enrolling in your spouse's plan instead of the employer-sponsored plan. So there's lots of features in here within the Picwell tool that can help understand the full benefit suite. There's also education around other types of benefits such as dental, vision, financial and voluntary products, education around, you know, including videos as well as personalized reasons why to consider these different insurance types based on this particular individual. And it's intended to be really easy and really fast. So some of the impact that Picwell's had, this is just one example. This is a case study of the impact with, this is a 5,000 life company that we worked with for multiple years. And we did this study with this company after they had been with us for about 3 years. So we took about 3 years worth of data. What we found was that Picwell users were more likely to choose plans that saved them money. And after we tallied up the premium savings and also accounted for differences in out-of-pocket costs, we found that Picwell users saved an average of $1,000 a year compared to similar employees who did not use Picwell. So in this case study, we were able to look at Picwell users versus non-Picwell users. These savings were primarily driven by higher enrollment in the HSA eligible plan option. We also found that if we just looked at people who enrolled in the HSA eligible option, the Picwell users were more likely to contribute to their HSAs, and they saved more in their HSAs, which has a big impact on their long-term financial health. We also found that in addition to employees saving, the employer also saved. Picwell users cost their employer less because they selected lower premium plans, and the increased HSA contribution also generated additional tax savings. Once we added it all up, we found that the average Picwell user at this company cost the employer $94,000 per year less than similar employees who did not use Picwell. So overall, in addition to experiencing potential cost savings, Picwell clients have also expressed that it's helped them with communications and education during open enrollment, which has resulted in higher employee satisfaction and less calls to HR, which I know is something we all desire. All right, so some of the questions that we get, first question is, what are some of the frequent challenges that, we hear from employers each year? And so challenges that we hear are, one, employees have a hard time choosing plans, and what tends to happen at times is they will either overinsure or underinsure because they don't really understand their risk or their potential for out-of-pocket costs. So they may go with the cheapest plan, but not realize that that may cost them more in the long run, depending on their healthcare needs, or they may overinsure because they don't understand that they're really not at a high risk of having a lot of out-of-pocket spend. So that's one of the challenges. There is sometimes a misconception that the HSA plan isn't a plan that's fit for them, particularly if someone's high risk. Because they are worried that they'll have to pay more out of pocket. But sometimes, if there's a really generous HSA contribution by the employer, that risk is minimized. However, it may be hard for that employee to understand that. And so really just generally helping employees understand their options is, really one of the biggest challenges, and how to communicate that to the employees.
So Jolie, I have a question.
Sure.
How are you guys, especially in the COVID environment of today, how are companies approaching you? Are they approaching you with more questions regarding, your total solution and how that impacts their organization from an educational component? Or just talk to us a little bit about the changes from maybe pre-COVID to now.
Yeah, sure. Happy to talk about that. Yeah, I mean, I would say that it is about educating. Kind of going into the next question here, are companies relying decision support systems now more than ever? And I would say, absolutely. As you had mentioned earlier, some of the changes that COVID had sort of changed the landscape a little bit, and we've seen that as well. So we saw a significant increase with the pandemic as employers couldn't hold the traditional benefits meetings that they would normally have in the office that you were mentioning earlier. This really increases the need to provide self-service tools to employees to help educate them, around their benefits. So I would say that, in the past year, compared to sort of pre-COVID, post-COVID, I think decision support has become more of a must-have than a nice-to-have. People are paying more attention to their benefits now more than ever. And so it's really become important to provide tools and resources to help them understand better.
I agree with that. And I think it's great that we can partner with our solutions. I mean, walking through your solution with several of our clients, there are several educational components that are built into the technology, which is really, really nice. But can you touch on really quickly how a client can customize based upon their needs? And the depth of that customization with, some of their contribution strategies and things of that nature.
Yeah, sure. So we configure the tool for each and every customer differently. We have a base product, but obviously the benefits and the contribution strategies and even the different types of benefits that are being offered vary from client to client. And so, as part of getting that tool ready, we'll gather all that plan data, all of those rates, and we'll make sure that, each client has their own unique information in there. It may be, different eligibility rules, but Picwell is completely configurable to each client's specific unique needs. And in addition, we do offer other benefit types and education around other benefit types. So, we want to not only highlight, hey, you're offered accident insurance, but here's reasons why you should consider accident insurance, because you told us that you're covering a child and you picked a plan that doesn't, has a deductible of $6,000, but you told us you can't afford more than $2,000. So we will configure each of those products that you're offering to your employees within the tool unique to each company.
I love that. And the great part about Picwell and TouchCare is if individuals still have questions, or if they want to go into more depth with some of the topics and areas that might impact them and their dependents, they can schedule a one-to-one 30-minute consultation with TouchCare after their Picwell experience to really wrap it with a bow. So very, very valuable. And thank you so much for joining us today and that information. Let's go into the 7 rules for open enrollment. And these are just 7. I'm sure there are probably 50 or 60, but top of mind, looking at the holistic approach, this does not mean that you should provide employees with tons of resources during OE and then leave them stranded throughout the plan year. So healthcare is an annual event. Claims are submitted every day by providers and facilities on behalf of the services that your employees have experienced. Healthcare does not become less complex following open enrollment. That is so important to remember, because oftentimes we spend so much time building up open enrollment and its primary event, and then employees are kind of left to figure it out for themselves after the fact. Remember to provide resources to help employees manage their benefits your company has offered annually. Leaving employees without resources to help them navigate throughout the plan year leaves a large gap in the overall benefits strategy. Leveraging advocates who are specialists is a powerful solution to ensure year-round education and support. So that's exactly what we're here to do. It's really let's make sure that we're teeing up employees with all of the information and all of the resources that we can during that pivotal time of open enrollment. But then let's not forget, now they're a healthcare consumer. So how's that going to be approached throughout the plan year, not just during open enrollment? Okay, and I also want to just target really quickly. So privacy is a big component of open enrollment. People can make bad decisions just because they're afraid to ask a question in a public setting. So I think this was on the previous slide, but at TouchCare, we offer a private environment for our members to disclose information in order to help them make plan decisions or help them navigate their healthcare efficiently. We protect our clients by reducing the amount of PHI that's provided directly to them by their employees. Oftentimes, employees need a safe place to be transparent. With a specialist, TouchCare is a confidential solution that is available for them and their dependents. Members can schedule a one-to-one 30-minute consultation during open enrollment, or if they have a qualifying life event, or if your organization hires a new hire throughout the plan year to discuss any topics they would like to address, or to ask any questions prior to making that plan decision and election. We do not physically enroll employees, but having that outlet for them to work with a specialist to really understand all of the plans and all of the benefits is super valuable. So rule number 2 is let's focus on the demographics here. Most organizations hire different types of people who learn differently, communicate differently, and who live different lives from their colleagues. Keeping this in mind when supplying resources for open enrollment is extremely important. Leveraging quick topic-based videos, webinars, including access to vendors for any questions, incentivizing OE activities with prizes, providing a robust OE guide, and offering a safe space as mentioned, for your employees to ask private questions are all important aspects of open enrollment. Set a realistic timeline, and I can't say this enough. There is nothing worse for employers, brokers, carriers, everyone, than waiting until the last minute to manage open enrollment. If you anticipate a down-to-the-wire experience, try to have as many resources aligned as possible to offer support to employees. We do know that sometimes this can't be controlled. That said, providing ample time for employees to make their decisions and for files to then flow to the carriers creates a much better experience for everyone. If you know there's going to be an issue with a timely carrier file submission, develop a proactive strategy to support your employees. I can tell you at TouchCare, we've supported several last-minute OEs over the years, including supporting members when there has been a carrier file issue overlapping their medical effective date. This is not fun for anyone, but giving up isn't an option. So you need to supply resources that will really help those employees through that situation. And rule number 4, communication is key. There is nothing wrong with over-communicating during OE. This is an important time that could have a costly impact on your organization if it's not managed properly. Also, never take for granted that dependents also leverage their benefits, because they do. Dependents use benefits as much as the employees do. Creating ways to offer support to dependents and to educate adult dependents on the benefits can have a significant impact on future outcomes. Our clients appreciate that we are always willing to educate and support dependents during open enrollment and throughout the plan year. Although tech is wonderful, believe it or not, and it's not all about technology. Even though many companies are almost fully reliant on technology these days, human interaction and personal communication is still extremely important, especially when discussing complex topics. When employees are confused or when specific individuals are asking many questions via your company's Slack channel, we suggest that you call them or you have them give us a call. Speaking through challenging topics helps employees feel more comfortable. We do suggest summarizing in writing, which is what our health assistants do following every phone interaction, but conversations are extremely valuable. Setting up a direct email with a benefits at option is a way to capture information, and it's also helpful. But having a specialist contact a confused employee or someone in need for an actual discussion reduces frustration and confusion. We do realize that HR teams run lean and are especially busy during open enrollment. This is another reason organizations choose to partner with TouchCare. And demonstrating value. Be proud of the work that you've put into your benefits package for your employees. Don't be afraid to be transparent and discuss the value of the plans your employees are being offered. Benefits are a big deal and oftentimes a selling point in a competitive recruiting environment. Our HR partners contact us directly to ask if we'll walk through benefits with potential candidates. Offering a solution like TouchCare ties your benefits package with a nice big red bow, allowing employees the comfort of knowing that a team of specialists is there to support their needs throughout their plan year. And that's extremely valuable and brings so much peace of mind. And the secondary and voluntary options. Oftentimes these options are breezed over during open enrollment, even though supplemental options have been put in place to enhance the medical plans. Decide to make these benefits a priority because they are so valuable. TouchCare supports the entire benefits package. During our one-to-one consultations, we highlight the supplemental and the voluntary options, and we support any needs employees might have aligning with these benefits throughout the plan year. And as Jolie mentioned, Picwell does the same. So the solutions work together to really educate and make sure that everyone has all of the information that they need to make the best decisions possible for themselves and for their dependents. All right, so to finalize, before we start answering questions, what employees should know. So this was made for them. You've created a robust benefits package for them, right? And they need that support and understanding that this was created for them as a benefit to them and to their families. Support is available, so supplying ample support, whether that's through TouchCare, your organization, however you can identify what that support is going to look like, is extremely important to them. And they're not alone in the process. So if you provide that support and that for their healthcare journey throughout the year, you're providing additional information to just help them become a better consumer and to drive that proper care and the proper way to really attack the healthcare market here in the United States more effectively. And transparency. I believe it's very important to tell employees why benefits keep increasing year over year. What's behind the curtain? So what happens with those contracted negotiated rates? Why do they exist? If we start telling people why, then they'll ask the appropriate questions when they go for that MRI. And they'll understand that the cost is different. So don't be afraid to be transparent when you're educating your employees about their benefits and about what happens with premiums and why they're increasing. All right, so that's a lot of information. I know that Jolie and I have spoken through some very impactful information about open enrollment, some food for thought. So we'd love to answer any questions that you have. All right, we're going to check the chat here really quickly. And let me look at the chat and see if we have any questions here.
I do see some questions here.
Oh, look at this. Lots of questions. Okay. How do open enrollment consultations work for employees? That's a great question. So with our one-to-one consultations, all an employee would have to do is click a link and go ahead and get scheduled based upon the availability that shows in the calendar. And that is, from 8 a.m. to 9 p.m. Eastern Standard Time, Monday through Friday. And this year, we're also opening on weekends through mid-December for open enrollment consultation. So when they click on that link, they'll be sent to a scheduler. They'll click on the date and the time that works best for them. They'll enter their name, of course, and the number that they would like to be reached. They'll supply a little bit of information for our team to do some homework prior to that consultation, and then we will call them at the date and time that they've chosen at the number that they've provided. Super, super easy. We provide a ton of resources to our clients. If they just call in, we go ahead and send them the link so they can schedule directly when the consultants are available. So we make it as easy as possible. Very simple process. Can dependents request an open enrollment consultation? Yes, they can. We actually really like for dependents to be involved in the process because, as mentioned, if it were the other way around and my husband were steering the ship of healthcare in our house, we would have a problem, right? Because he doesn't have the information that I have. So it's important that everyone is as educated as possible prior to making that decision. How does Picwell technology work with TouchCare? Jolie, do you want to take this one?
Yeah, that's a great question. So they really complement each other, which is wonderful. Picwell, is the tool that employees can go in to get a quick overview and a quick understanding and help them make an initial decision. But Picwell doesn't have all the answers. So within the tool, there is some information that says, contact TouchCare if they have additional questions. And that's the beauty of it, is that, Picwell can sort of weed out the noise, the frequently asked questions or the repetitive questions that, HR might get or TouchCare might get that are really easy to answer, that might be able to be answered through a tool like Picwell. And that will allow TouchCare to really focus on the more complex situations and the questions that people might have about their unique situation that can't be answered from a tool like Picwell. So technology can't answer everything. And so that's why this partnership really complements each other. Picwell can get some employees to what they need, and then TouchCare can answer all of the other questions that a tool or technology can't answer.
That's great. Another question is, what is the timeline for getting started with open enrollment at TouchCare? So if you're integrating Picwell and TouchCare, we do require 30 days for that integration. If you're leveraging TouchCare for the one-to-one open enrollment consultations, we require at least 2 weeks. And the reason is we need to make sure that we have all of the information. That open enrollment guide is very, very important. The SBCs are very important. All of that is uploaded into the system, and the team can be trained. And by the way, there's a dedicated pod of health assistants that align with each client. So those individuals are trained on the benefits that are specific to that organization. And we need to have time to do that, obviously. So once all of that information is uploaded, we have a basic census file that includes first name, last name, date of birth, and user type, which means are you an employee or are you a dependent? That's the information that we require for open enrollment, including all benefits eligible employees. So that information is uploaded and you're ready to go. So we have a 2-week turnaround for open enrollment. Support, and then, we get all the information ready and we're ready to support the entire population on their medical effective date with the full core solution. All right. Let's see here. I think that wraps up our questions. If anyone has any additional questions, we'll give you a couple more minutes.
There is a question here, Codi, that says, can you tell me more about how Picwell scores plans for employees?
Oh, I missed that one.
That's okay. I'm happy to answer it. Yeah, so Picwell takes, a unique approach compared to, other tools out there. What we're doing is we're leveraging a large national claims database with millions of people. And what we're doing is we are asking a very small set of questions that is high level, demographic information, just age, gender, what prescriptions you take. It's all anonymous, so employees come into the tool anonymously. Picwell doesn't collect any personally identifiable information. And as they answer these questions, there's also some questions around their personal preferences, such as how risk tolerant they may be or their capacity to pay a large bill. But after they answer that handful of questions, Picwell is looking for people like them. So we're taking those answers and we're putting you into buckets of people like you and looking at the claims data of people like you in that large national claims database in order to come up with potential predicted healthcare utilization. So we're looking at those averages of people like you, how many times they go to the doctor, what's their healthcare spend each year, running through lots and lots of different scenarios to come up with those averages. So we are taking that information, predicting your costs for each plan, simulating against each plan that you're being offered. And that is how we're coming up with not only a Picwell score, the higher the score, the better the plan for that particular person, but we're also coming up with your potential cost estimate of what your potential out-of-pocket costs may be above and beyond just the premiums.
Okay, I do believe we have answered all of the questions that are in this chat. If anyone has any additional questions, please feel free to reach out to us via sales@touchcare.com. We'll put you in contact with the appropriate people and make sure that all of your questions are answered. Thank you so much for your time today. And I'm sure, I know that this session was recorded and will be distributed. So please, we look forward to hearing from you, and I hope everyone has a wonderful rest of your week.
Thank you.
Thank you.